Also, Congressman Tom Price is here with us too from Georgia. Congressman, thanks for coming over.
Absolutely, great to be with you. Great to just applaud one of my dear friends and colleagues here in the House. Michele Bachmann does such a wonderful job, and the kind of job that she did for taxpayers back home in St. Cloud, she's trying to do for all Americans here in Washington. We just appreciate it so very, very much. The whole issue of tax policy that she's championed in her work on the financial services is just great.
I'm hearing the alarm go off. Does that mean that votes are going to be cast pretty soon, or what does the ringing of the clock mean?
It does means we have a vote relatively soon, but we've got a few more minutes, and happy to continue to talk.
Well, very good. I want to talk a little bit about some sanctuary city, some money that, as I understand, is being talked about or bandied about in Congress regarding immigration and that kind of stuff.
The whole issue with illegal immigration is absolutely huge, as you well know, and it seems to have vanished from the front pages of the newspapers and from the news.
It has. It absolutely has.
And that doesn't mean that it's left the importance of what Michele and I and others are working on, because we understand and appreciate that border security is imperative, and that's the first step in this process. The CLEAR Act, which Congresswoman Blackburn was here, she's championed that Charlie Norwood had for a long time. What that does is makes it so that local jurisdictions will have monies to be able to detain and retain individuals who are caught here illegally until the feds come and do their job.
Well, wouldn't that be nice?
And really, that is the problem. The federal government has been remiss in doing their job of border security, so it's very important that we empower local units of government so that they can keep the people safe.
The CLEAR Act, is that an acronym too? What does that stand for?
Well, we have so many acronyms, I'm not going to be able to say what that one is, but
we got FISA,
clear vision forward. We'll take it in terms of clear vision forward on the issue.
Dr. Price is a physician, which is marvelous. It's wonderful to have physicians here in Congress, and Dr. Price brings not only that expertise, but a number of other areas that he has great interest in, but he's been a real leader on healthcare reform as well.
Yeah, doctor hurts when I do this.
The appropriate answer is, well, don't do that.
Oh, thank you very much. Yeah, we just have about maybe a minute left on that. What can you tell us regarding healthcare? Are we going to get some help from the government?
Well, as Michele knows, help from the government is oftentimes lacking, and then when you do get help from the government, it's oftentimes in the wrong direction. Michele believes, as I do, that patients and doctors ought to be able to make independent medical decisions. What we need to do, I believe, is raise the level at which we're looking at this issue so that we fundamentally solve the problem and not tinker with a system that's woefully broken. I look forward to working with Michele as we move forward to solve that.
Well, and again, more government handouts to pay the exorbitant prices, I don't think is any kind of a long-term solution. So I'm glad to hear
socialized
you're
medicine won't be the answer. It hasn't worked well in Canada, and we don't want to have socialized medicine in Minnesota.
What's the phrase? If you think healthcare is expensive now, just wait until it's free.
That's right.
At 11:57, 3 in front of 12 o'clock Eastern, 10:57 Central. We'll be back to wrap up our live broadcast from Congresswoman Michele Bachmann's office in Washington, D.C. after this.